this paper on the epidemiology of abdominal aortic aneurysms in the US provides data on the epidemiology of the disease in the last 40 years. As you all know, the last published data is from the 80s, and there has not been a modern update. We do not know if the supposed rates of aneurysm occurrence have changed in this population, and that is what this article addresses. The rate of rupture in men has reduced dramatically. In clinical practice, we find that the relative rates of rupture in women are higher in comparison to men, and this is borne out by the study as well. Women are older when they present with aneurysms, and in our study, did not do worse after treatment in comparison to men.
This content is copyrighted by Mayo Foundation for Medical Education and Research.